Okay, so we're talking about those childhood illnesses and diseases. Some of them are bacterial, some are viral, okay? A lot of the ones you guys are gonna present to us today, some of those have vaccinations that you get in childhood, okay, to help prevent your child from getting them, or you when you were a child. So that's what we're gonna be talking about today. It's in chapter 43 in your book, okay? So there probably will be a few questions over a few things we will not present today. I didn't have enough groups, and I knew we wouldn't have enough time to have everybody present if I did everything. So I will kind of give you guys a breakdown on the study guide of some things you want to cover in the textbook that we don't cover in lecture today, okay? So I hope my study guides help. Do they seem to help?
Yeah.
Okay. Of course, I'm not going to give you exactly what I'm going to put on the test, but I like to kind of steer you towards what you need to know. Just remember, keep in mind, when it comes time for NCLEX, you have to be well-rounded, okay? I want you to do well on my test. That's why I kind of create study guides to help steer you towards what you need to know specifically for my test. But just always remember, when it comes to NCLEX, you've got to be well-rounded, okay? So outside of what you're learning here, sometime in your free time, you need to start practicing those NCLEX style questions. I've started working on a Word document that I'm going to upload to Canvas that's going to have some different apps and websites that I know personally that people have used and worked well for them. It's not ones I get paid to endorse or anything like that. It's just ones I've heard about, people have used in the past, and they work for them. The apps on your phone are usually pretty reasonably priced. They'll send you like a couple, like 10 to 20 NCLEX style questions a day for you just to practice going through. You can usually flag if you knew it or if you were unsure or partially knew it, and then it kind of keeps them in separate groups. So that way you can go back through and practice, okay? And there'll be things that will come across and be like, I've never heard of that, but it's going to happen. I mean, we can only teach you so much. You've got to kind of start trying to absorb a little bit extra outside of what we teach you, okay? Okay, so chapter 43 is where we are. So here are your student learning outcomes, okay? And of course, we're also going to be talking about several different variants of childhood illnesses today, okay? So there's a chain of transmission, okay? Whenever you're looking at how do people get sick. We probably are way more aware of this chain of transmission today in our day and age of COVID than most people were 10 years ago, okay? Yes, we knew people got sick. We knew that, someone had a cough, they needed to cover their cough, but now we've got, most people know that if they're in droplet or airborne isolation, or if they're in contact, you have a better understanding of that now than you probably would have being in nursing school 2 years ago because of COVID. So we have our pathogen or agent, so it can be bacterial, it can be viral. You have your reservoir, which usually is the human body. Could be a tabletop, it could be a food. There's lots of reservoirs. Soil for like toxoplasmosis, parvovirus. Portal of exit. How does it exit? How do we usually spread our germs? Cough, sneeze, rub your nose, touch a table, okay? Rub your eyes after you've touched a table, okay? Transmission, that's how we spread it, okay? You don't wash your hands after you cough or sneeze into your hand, okay? Or you're a waiter or waitress at a restaurant and you've got a spot on some somewhere before you put it on the table and you clean it off with your shirt, lay it on the table. It happen, right? Portal of entry. What is a portal of entry? Okay, you're standing by someone coughs or sneezes, you breathe in. You touch a tabletop someone else has touched that's got an illness, a virus, sickness. You eat food that someone has prepared that did not wash their hands after going to the bathroom. I know it grosses people out, but really it happens. When I was growing up, my favorite burger place in the town I grew up in was called Watson Burger, not Whataburger, Watson Burger, okay? There were two, one in Durant, one in Denison, Texas. And there was a hepatitis B breakout from Watson Burger.
Was the burger place good though?
Huh?
Was the burger place good though?
Oh, it was right. It was great. And it stayed open. Exactly. So it stayed open, but a lot of people had to close down, they had to clean everything. Of course the health department went in, but then it opened back up. So, and then you have your host, your susceptible. Okay, somebody say it. Susceptible. See, thank you. Me and my son. Host. Okay, you have your host, your person who's carrying that variant, that bacteria, that virus. Okay. So forms of transmission. So we kind of mentioned those without using the specific terms. Direct, person to person or animal to person. Me and my family was talking last night. We went to Garden City last year and we all got sick. We stayed at the hotel that had the pool in it for a couple of nights and we swam and stuff. I was like over COVID. I'm like, I'm done. Just going out in the public, no mask. Well, then we all got sick, and I'm like, oh my gosh, we got COVID. Well, we didn't. But we were talking, we all had like a stomach virus. Where do we think we probably got it? We were like, okay, could we have gotten it from the zoo? We went to the zoo, petted the animals. We went to the water park. We were there playing in the water. Can water carry variants? Yeah. Okay. We ate at several restaurants. We could have gotten something from there, right? So it's a direct contact, okay? Not washing your hands after shaking hands, okay? Most of us, who carries hand sanitizer in their car? Who carries hand sanitizer in their backpack or purse? Who carries hand sanitizer in their pocket sometimes? Okay? Most of the time, some of us nowadays have hand sanitizer on us, right? Were you that way a year and a half ago? Some of you probably were, but some of you probably weren't, right? But COVID has made us more aware. Okay, indirect. Contact with a contaminated object. Again, countertop, tabletop, going through the grocery store. Even though I know things I touch at Walmart's probably not dirty, when I leave, I feel like I need to wash my hands. Okay? Or if I, go to any store, clothing store even. If I'm shopping around, I come out, I feel like I need to wash my hands. Are they visibly dirty? No, but it's just that thought of contact with things that you could susceptibly bring home to your family, okay? Vectors, so you have insects. So what is one virus in the last few years we can think of that was carried by an insect? Zika virus, carried by mosquitoes. What's some other ones? West Nile. What's one we don't have here, but Africa deals with a lot? Malaria. Okay, that's carried by mosquitoes. Okay, so we have variants. What's something ticks carry? Lyme disease. Rocky Mountain spotted fever. Okay, so there are things that insects can carry, variants that we can get from them. Has anybody heard of the I can't think of the name, but it's an illness people get after getting bitten by a tick, and then they're all of a sudden allergic to red meat. Have y'all heard of that one? It's just recently in the last few years. I can't think of the name of it, but they'll get bitten by a tick. They get this virus or whatever, and it causes them to be allergic to red meat. I would die. I love steak. Okay. So now we have to think about how do we develop immunity after we've been exposed. Okay, there's two types. There's passive immunity and there's active immunity. Okay, so passive is where antibodies are passed on. Can someone, without reading the slide, think of a way this happened? Breast milk, mother and fetus, right? Okay, so mom gets the Tdap vaccine during pregnancy. Those antibodies are the type that can cross the placenta. Not all can, but the Tdap vaccine, the antibodies that are produced by mom's body can cross. So that is a way to kind of help protect the baby. Then post-delivery, mom breastfeeds. Because baby, do they have an immune system? No, they have to build their own immune system, okay? So breast milk, okay, so fetus to newborn through the placenta, and breast milk. Okay, those are two ways that passive immunity happens. Immunoglobulin, so this is used when the need for antibodies is sooner than the body can develop them. Can someone tell me a type of immunoglobulin a newborn might get if they're exposed to something from mom? Kind of a harder one, you may not know. What's the vaccine they all get usually at birth? Hepatitis B. Why do we vaccinate for hepatitis B? Okay, so hepatitis B can be one mom could have and we not be aware of, even though she got the, we had the antibody screen early in pregnancy and she later on caught it after the antibody screen, okay, Hep B. Hep B is also something that's foodborne, can be passed by body fluids on. So it's something we know we can protect baby against early on. So if mom is hepatitis B positive, we're going to give them the vaccine and then we're going to also give them what? HBIG. What is HBIG? It's an immunoglobulin for the hepatitis B. Okay, so baby doesn't have those antibodies yet. It's been exposed through delivery, right? Because mom's going to bleed. Baby's born vaginally or C-section is immediately exposed to Hep B. Okay, so we're going to vaccinate baby, and then we're going to give baby its antibodies it needs to fight against that virus it's already been exposed to.
It's not like a vaccine.
No, HBIG is it's basically the antibodies is what we're giving them. Okay, so the immunoglobulins we're going to give immediately to baby. Okay, and so it's going to help start the process of the body developing more antibodies to fight against that hepatitis B virus that's been exposed to. And we're usually going to give that within an hour to 2 hours from delivery. I mean, it's usually pretty quick. Okay, it only lasts for a few months. Okay, it allows the body to then start producing those antibodies. So active immunity, this is when antibody development occurs through immunization or exposure. Okay, either you get immunized, like for the COVID virus, or the flu, or whatever, measles, mumps, rubella, all those things we get vaccinated for. And then our body starts developing antibodies. I am one of the few in this room that probably has ever had chickenpox. Anybody else have chickenpox in childhood? Okay, so a few of you. I still have scars from my chickenpox, okay? But when I was a kid, we didn't have the vaccine. The varicella vaccine was not developed yet. They probably were working on it, but it hadn't come out. And so we had chickenpox parties. So if somebody got chickenpox in the summertime, your parents would want you to get chickenpox in the summertime rather than during school because they didn't want you to have to miss school. So I had a cousin who got chickenpox when I was 4. So guess what? I got chickenpox because I went to their house so I could get my chickenpox. And everyone knew the older you get, the worse it was for you. So adults who get chickenpox, it can be deadly for them, okay? It can be bad. There are people that can get chickenpox twice, and why would that happen? How could you get chickenpox twice?
Feel like a different strain.
Nope. What happens is okay, so with your MMR, women who have the MMR vaccine, they get tested every pregnancy. I had to get a booster, basically. Because what happens is over time, those antibodies can decrease, and the body stops making them. Okay? So if you had the chickenpox when you were younger, maybe had a pretty mild case, and your body didn't develop a lot of antibodies, and over time it slowly stopped producing, well, then you no longer have enough antibodies or no antibodies to fight against that virus again, and you get exposed a second time, you could get it a second time. Okay, so that's why some vaccines, like your Tdap or your tetanus shot, you get a booster for. Some women have to get a second MMR. Can't get it during pregnancy, but they'll give it to you postpartum because it is a live virus. So that's your active immunity, exposure, or you receive immunizations for it, okay? So what is a communicable disease? So it's an infection often caused by direct transmission, indirect transmission, or by vectors, okay? So we've already talked about those 3 things. So you have an infectious agent or pathogen, an effective means of transmission, in presence of the susceptible host. So that's anybody that maybe has not been vaccinated against that variant, or maybe someone who's immunocompromised because they have cancer, or it could be somebody that has Crohn's disease or RA or any kind of other immune system disorder that they have to take medication to reduce that immune system from fighting against their body. My brother-in-law has Crohn's, so he takes Humira. My mother-in-law has RA, so she takes Humira. And both of them are at higher risk of getting the flu or COVID or anything like that because their immune system is depressed purposely. Because if not, their immune system fights against their own body and causes these conditions to get worse. Okay? So, anybody that's not been vaccinated. So, if you get exposed to the flu and you haven't had a flu vaccine, or if you did get the flu vaccine but the flu has mutated, are you still a susceptible host? Yeah. Okay. Yes, ma'am.
Back to the chickenpox, is it, you can only just, like, I got vaccinated when I was younger, obviously, but I only had, like, one little bump. Is that possible to get one?
Yeah, it is. If you have a pretty mild case, yeah, some people may only have a few and not feel very bad at all. Just like with COVID, we have people who have no symptoms and people who die. So it just depends on how your body responds.
On a trip, and my roommate goes for school. I don't know if she had chickenpox, but she was completely covered in bumps, and she would always put lotion on. I don't know where the school allowed her to go, but
right.
I didn't know she had chickenpox.
She probably didn't tell the school, and she just went anyways. That's what happens. Yes, ma'am.
How long does it take for a vaccine
to become effective? Usually it takes a few weeks to a month. Okay, so like with the COVID vaccine, now the CDC just this week has come out saying that if you had both doses and you're 2 weeks post-vaccination, say I had the vaccine and Zenny had the vaccine, we could actually conversate and be within 2 feet of each other without having a mask on because we're both vaccinated. Okay, that's their new guideline for vaccinated people that just came out this week. So it just kind of depends on how your body responds, but usually 2 weeks to a month, you should have enough antibodies that you would be considered immune to whatever you would be exposed to. But of course, like I said, it depends on your body.
So like say, get the second dose and do like MMR COVID or whatever. Is it just
Well, there actually are some studies that are showing like the Pfizer and Moderna that really it's like 92% effective after the first dose, that you don't even really need the second dose. But I think that they were just being a little bit overcautious because they weren't sure how long it was going to last. And we still aren't sure because there's people who get COVID and a year later are still having positive antibody tests, and people who get it and 2 months later have negative antibody tests. So it just depends on the person's body and how they respond. So they're not, it's kind of one of those things, they're not real sure why some people are having antibodies longer than others. So, with the Moderna and the Pfizer, they're saying right now, really 1 dose, but they're still recommending getting the second dose until they do some more studies. So ideally, with 1 dose, you could probably be considered immune because they say it's 92% effective. Okay, so disease onset. So you're going to have the incubation period. So it's the time or interval between exposure and when symptoms occur. And sometimes in certain viruses, this is when you were actually going to be shedding the virus and can be susceptible to other people. Like people could get the infection from you. Okay, you are a lot of times without symptoms, but you're going to give it to someone. Okay. So the prodrome period is a phase of early symptoms of infection until the actual onset of the disease. So this is when you're going to have those early symptoms. You're going to start feeling feverish. You're going to feel that malaise, which is like you don't feel like doing anything. You're tired. You're exhausted. You don't want to get out of bed. That was my daughter this morning. I just don't feel good, Mom. Like, you're fine. Go to school. She's at home in bed. So, vulnerability, we were going to do a little exercise, but we don't have time. So, I put it on there for you. So, newborns have limited protection because remember, they have no immune system, okay? They only have what was able to pass through placenta to baby and whatever baby does receive through breast milk. I encourage my moms, even if they want a bottle feed, please, at least in the first 24 to 48 hours, if you can breast pump and give to baby, or even just latch baby once or twice to get some of that colostrum. Some is better than none. Okay. So immature immune systems, they have incomplete vaccination. So most babies can't be vaccinated until, they can get their hepatitis B at 1 and 2 months, get a few more at 2, but most of the time it's 4 to 6 months. So they have a pretty big window there where they can be exposed and get sick. Non-breastfeeding moms, those moms are like adamant, no ma'am, I'm not going to, which I'm like, okay, fine. But I try to educate, and as long as they understand, we're good. Passive immunity only lasts a few months after birth. So any antibodies they do get from mom, their body's going to produce some, but it's not 100% effective. Like they need to have those vaccinations to help further carry on that immunity. Develop active immunity with exposure and immunization. So they're going to get, as they get exposed in childhood, there's childhood diseases that every kid is going to be exposed to. Almost every baby and toddler gets roseola once in their life. So has anybody's kids in here had a high fever for like 3 days and then like 2 days later developed a rash? That's called roseola, okay? It's one of those ones that, most of the time mom and dad don't realize what it is because they have a high fever, they're sick, and then sometimes then they'll put them on an antibiotic and then you get a rash 2 days later and they're like, oh my gosh, they're allergic to the antibiotic. But it probably could have been roseola, okay? So roseola is one that a lot of people miss because of that. You don't develop that rash until 2 days later, okay, 2 to 3 days later. Children, of course, they have poor hygiene. I'm always asking my 4-year-old, which actually she's 5 today, guys. Oh my gosh, it's her birthday. I got up early to decorate the house for her because that's a tradition in our family, and we get out and decorate for the birthday. We put streamers over their bed. So they don't wash their hands good. I'm always like, when did you wash your hands last? I don't know. Okay, go wash your hands. That is one thing my poor older children are avid hand washers because their whole life have always been, when did you wash your hands last? But they just don't think about it. It's not something in their nature. Now, I am also one of those parents that I want you to go out and dig in the dirt and the mud and get exposed to things because I want your body to fight against things. You need to develop some immunity, okay? It's very important for you to develop some immunity. Otherwise, you're going to be a sick child off through school and have a hard time, okay? So immunity is important, but we also need to make sure we protect them against things that they don't need to be exposed to. So going to the bathroom, they don't always wash their hands, okay? So always remind them, did you wash your hands? Did you use soap? Did you make bubbles, okay? Because a lot of times it's the soap, water, I always say, did you make bubbles? That's a good way to teach a toddler. Soap on their hands, a little bit of water, and have them make big bubbles. I taught preschool for many years before I was a nurse, and so we would make big bubbles and rub on both sides and make big bubbles, okay? Toys. Oh my gosh. Kids that go to daycare. What's the first thing a toddler does? Puts it in their mouth, right? They got to taste it for some reason. I don't know what that's about, okay? It goes in their mouth. And they have a cold. What's going to happen to their friend? They're going to get the cold, okay? Then you do have people who are anti-vaxxers. That's their choice. That's why we live in a free country. Everybody has that choice, but I just always want to make sure if you have a patient or if you are a person, then you just make sure they educate. Yes, ma'am.
On the roseola rash, is it only for children?
You're going to see it more predominantly in children. Adults can get it, but they're usually going to be a lot sicker. They're going to get more sick than a child will just because they've never been exposed. But it's kind of like one of those things that most of the time you're going to get in childhood. But adults can get it.
Like teenagers? They get it?
Yeah, teenagers could get it. Yeah. I mean, really anybody can get any virus at any age, but most of the time, most people at some point in their childhood were exposed to it and are going to have antibodies to fight against it. But if they never were, yeah, they could still get it. Yes?
Does not being vaccinated hurt people that are vaccinated?
It doesn't, but then you've got to think about those people who can't get vaccinated. Okay, if you have someone who is immunocompromised because they have cancer, they can't always get those vaccines that have live viruses because their body is not going to develop the antibodies. They're going to get sick from it. And so you have to think about the environment and the people around you, not just what you're doing for yourself, you know. But we do, like I said, if that's your choice, that's your choice. I have some really good friends that none of their children are vaccinated, you know, and that's just one thing we don't talk about. You know, we're good friends, but we just don't discuss that because we have different views on it. So, okay, so role of the nurse in the health promotion, okay? So we, again, are educators. Along with being a nurse and caring for that child, we have to also educate the parents, okay? We have to teach good hand hygiene. We've got to promote immunizations. If they have fears and concerns, tell them not to read Dr. Google, okay? Give them the good data from the CDC, okay? From reputable sites, okay? Separate an ill child from well children, so educate. If you have one kiddo that gets sick, keep them in their bedroom, have the other kids stay away, okay? Because you can limit exposure even in your own home. Eliminate habitat or reservoir hosts. So if you have, you live somewhere that's very moist, like I grew up in a place that has lots of water all the time. We get lots of water, rain all the time. So we have tons and tons of mosquitoes. Okay, that's the only thing we have to deal with too bad out here. And so growing up, we would have to make sure if we had a good rain, we would go through and dump out the water out of every little thing that could gather water. Because if you didn't, what's going to happen? Mosquitoes are going to grow. Okay. So find those ways to eliminate hosts. If you've got, if you've got an overrun of insects, do some spray. Okay. Kill the pathogens. Sanitize the toys and surfaces. Okay. That's why after you guys leave, since this COVID stuff has started, we have to spray the tables and wipe them down every day after class. At some point in the afternoon, one of us walks in here and does that every day, okay? That's something that maybe wasn't always done as often before, but we're trying to reduce that risk of spread of COVID, okay? Use standard transmission-based precautions. So just again, cover your cough, wash your hands, all of those things you can easily do. That's what standard transmission means. How can you easily stop that transmission from one place to the other, okay? When providing care, you're going to keep the sick from the well. So say, next year you go on, get your RN, 2-3 years later, you become a charge nurse. You have a patient that has influenza on this side of the hall, and you have a patient over here that's just had a hip replacement surgery. Are you going to give the same nurse those two patients? No, you're going to try not to, right? You want to keep the nurse with the sick patients and the nurse with the well patients, okay? Same idea in the hospital setting. You want to try to prevent that cross-contamination if at all possible, okay? So we also want to keep all surfaces clean. So this is one thing I kind of do out of my own habit is when I get to work, I don't know who sat in my workstation last. So a lot of times I will just get a sandy wipe and I will wipe down the desk in front of me, the keyboard in front of me, even though I know during that shift, probably 4 or 5 of us with different people are going to sit at that keyboard and type. But if I can decrease some transmission at that moment, I'm going to do it. Okay. So just take those opportunities, even at home, wipe down your kitchen sink. My kids have a chore list they have to do every day. One of their daily chores is they have to wipe down the bathroom sink with the Clorox wipe. And that's just one way in our own home we can reduce the transmission at home, okay? And always use proper hand hygiene, okay? Hand sanitize when your hands aren't visibly dirty. If your hands are visibly dirty, use soap and water, okay? So immunization. So this is kind of how the pathophysiology works. So you get the antigen introduced. Your body has an immune response. So with my COVID vaccine, okay, after my first dose, I just had a sore arm. After my second dose, I had about 36 to 48 hours that I felt like pooping, okay? I had a fever. I had chills. I had malaise, okay? But what was that? It was my body's response. What is it doing? It's fighting, which is making what? Antibodies, right? So when someone says, oh, every year when I get the flu shot, I feel so sick. Did they get the flu?
No.
No, they had an immune response, correct? Now, if you truly tested positive for the flu after you got your flu shot, did the flu shot give you the flu? No, you had been exposed sometime in the last 7 to 14 days to someone who had the flu, and your body was already flu positive, I'm sure, but you didn't have any symptoms yet. You got your flu shot, and then you got sick. Because how long does it take for a vaccine to work? We talked about this. A couple weeks, right? To a month. So, your body's going to have an immune response. Some people aren't going to really feel any different. Some people are going to have a little bit of negative reaction. I did. I woke up in the middle of the night and I was like, shake, chills, okay? I had to go to the bathroom. I put my robe on, got to bed, covered up with 3 more blankets. Was that the smart thing to do? No, but it worked. Took some ibuprofen the next morning. I was good. So your body is building antibodies, okay? So then you have active immunity to that disease, okay? So a child receives vaccines from for about 14 different childhood diseases, okay, by the age of 6. Now, I will say I did pace my children's vaccines out a little bit. They did not go to daycare, okay, when they were small. I worked PRN on the weekends. My husband and I just worked opposite, so one of us was always home. So I did space my children's vaccines out a little bit because that's what I chose to do, okay? But they weren't required. Most state agencies, if your child goes to like a public daycare or school, now they all had their vaccines by the time school started. But because I didn't have them in public daycare, I didn't have to have them on schedule, okay? So you're going to get about 14 different childhood diseases they're being vaccinated for by the age of 6. Okay, there are some boosters that they're going to get around the age of 12. The HPV vaccine is now recommended for males and females. You can start getting that at the age of 10, okay, if you choose to do that for your children. And then at the age of 12, they will get their Tdap, their tetanus booster. And every year, you should always give them a flu shot. Now, the younger children, babies, they get usually 2 doses of the flu. They don't get the full dose in one shot. It's usually 2, okay? And there are different types of vaccines as far as the flu. They have a nasal spray or a injection, but you do have to watch children that have upper respiratory issues. You should not use that nasal spray for them, okay? Because my daughter, she has asthma. She can't get the nasal spray because it, it is somewhat of a, it's a dead virus, but it could cause adverse reactions in her. Okay. So we're going to talk about the different types of vaccines we have. Okay. So we have killed virus vaccine. So this is a dead microorganism that's still capable of causing a human antibody response. So one of these is the inactivated poliovirus. Okay. You have toxoids, so this is a treated toxin through heat or chemical that weakens the toxin's effect and still retains the antigen so the antibody response can occur. So this is like your Tdap, your tetanus toxoid. Okay. You have live viruses, so a live microorganism that has been weakened or attenuated is another word you might see. So measles or varicella, these are examples of the live viruses. Recombinant forms of vaccines. So an altered organism that is used. So one example is hepatitis B or pertussis. It uses the proteins rather than the whole cell to stimulate active immunity. Conjugated forms of vaccines. This is another altered form that joins another substance to increase the immune response. So this is the Hib vaccine. It is conjugated with the protein carrier tetanus toxoid, but there is no immunity to tetanus. So they use the protein from the tetanus toxoid to carry in the Hib vaccine. need to add our RNA vaccines to that, as we now have RNA vaccines that we're using, but we won't be tested over this. Okay. So vaccine reactions, what can occur? So you can have, you have your immune system response. We talked about that. You can have fevers, chills, melees, just not feel good, okay? You can have local reactions. So you have the erythema or swelling, pain or induration. So with, has anyone seen an older person that's had the smallpox vaccine? With a little circle on their arm, kind of indented. Have you ever seen that on someone?
I haven't.
Okay, and some people, if they got the smallpox vaccine when they were a child,
It looks like a scar, huh?
yeah, it does. It scars. So that's the induration, or that it goes in kind of, it does scar. Yep. Yes, and it's because in Mexico, that is a vaccine you get as a child that we don't vaccinate here for in the U.S. because it has been eradicated. You don't
Oh,
see.
they go, oh, where are you from? Oh, Mexico.
Yes, exactly. And so there are some countries now, a lot of, if you're in the military, that is one vaccine you still will receive, that other people do not receive the smallpox.
Oh, why did it cause that? Like,
It's just how it reacts with your tissue there. Yep.
I think it was me podcast. We Googled the needle.
Yeah, and it has it has all the different dots that go in. Yeah.
So they don't give that out?
Not to it's not in the general population. Just military and then a few countries overseas. Yeah. Yeah. Military, if you were in the military, you get lots more vaccines than the rest of us do, because you get to go to a lot more places. So then you have your systemic reactions, which we talked about: fever, fussiness, irritability, malaise, don't want to eat, that anorexia. You can get a rash. You can have joint pain. With the COVID vaccine, a lot of people are complaining of joint pain. And I will say, after my second, I had a lot of arm discomfort, like down in my elbow and my hands, but I have arthritis, so I just kind of assumed it caused that to inflame. And then you can have the severe reactions, which is anaphylaxis, okay? And that's where, you get the swelling in your tongue, swelling of your throat, can't breathe, kind of thing. Yes, ma'am. When they have the vaccine, I think it's not necessarily related to the vaccine, because think about how long it takes for that really to get through that tissue and into your bloodstream. I think it's more so related probably to the anxiety of getting the vaccine, okay? Because what happens when you get anxious, you get tense, right? Okay, when you tense up, you're causing pressure on that vagus nerve, correct? You get the injection, you relax, what's going to happen? Your blood pressure is going to drop, right?
I saw like two reactions where one guy had a heart rate of 130.
Right. And so it's more so going to be related, not so much to the actual the vaccination that's going in, it's going to be to that person's response. So they're going to be very anxious and tense a lot of times, because a lot of people don't like needles, okay? Maybe, they want to get the vaccine, but they're still a little bit scared of what's going to happen, I'm not a zombie, I didn't throw any more heads, kind of thing. So they're still anxious. And so I think that's more of the reasoning behind it, is you're going to see that vasovagal because of the response to, I'm tense, I'm putting pressure on my vagus nerve, and then I relax once I'm done, and then my blood pressure is going to drop. Okay. Oh, antibody, or on your anaphylaxis. This is one thing. Some immunizations, vaccinations are grown in eggs. Okay. So, or gelatin or yeast. So if you have someone who is allergic to those types of things, if you know the vaccine you're giving, like the flu vaccine a lot of times is grown in eggs, then it's going to hold some of that protein from the egg matter, and so they cannot take it, okay? Because if they're allergic to eggs, they cannot get the flu vaccine. So that's why it is always important to not only ask about drug allergies, but any food allergies when you are asking a patient about allergies. Do they have any food, latex, or drug allergies? Okay. So So when do we administer? So, bless you. So the first immunization should be given when passive immunity decreases or disappears, so about 6 to 12 months. But that hepatitis B is that initial vaccine we give usually in the hospital. They get again at 1 to 2 months. Okay. So that Hep B is earlier. General considerations: if someone has a fever, you're going to hold giving that immunization until later. Yes, if they're, well, not necessarily at birth, because a lot of times that temperature is not related to infection. Say if mom had a fever or had a higher, because when you're in labor, you can run up to 100.5 without being considered having an infection. It's just your body's response to the labor process. So that baby's going to come out warmer. So as long as their temperature comes down and levels out and remains normal, then you're going to give it. Okay. But in kiddos, if they're sick or they've had a fever, you're not going to give an immunization. You're going to hold off. Okay. Some immunizations can cause a fever. It can even cause some irritation of the site. Some kids can even develop somewhat of a rash, because think about some of those illnesses that cause a rash. They can develop a little bit of a rash after some vaccinations. Yes, ma'am.
I have a question. Can you give them like Motrin or Tylenol before getting their vaccine?
Yes. Yes. Now, of course, right now they're saying with COVID vaccines, they're not wanting people to over-medicate with Motrin and Tylenol, just because they're wanting their body to develop that immune response. So they're going to get a little bit of a fever. So, like, if my kiddos don't run 101, I don't give them Tylenol or ibuprofen. Right. Okay? And the reason I don't do that is because that's their body's natural response to build antibodies. Okay? Yeah. So if I immediately knock that fever down, they're going to not respond as well to whatever they've been exposed to, and they're not going to produce antibodies as readily as they would if they ran that little bit of fever. That's your body's natural way of fixing the problem. Okay?
I know because I used to work at a clinic, and the girls would always tell them, well, when you come back for your shots, give them
yes.
a little bit of Motrin.
And right, and with the right, you do. And I think it's more so to just kind of help the mom feel better that maybe they're not going to hurt as bad once they get the vaccination. And it will help them make them feel a little bit better. But a low-grade fever, it's that body's response. You know, if it gets above that, then yeah, you want to medicate if it gets above 101. But most of the time, you know, unless my kids are on 101, I don't give them ibuprofen. And it's just because that's your body's natural response. So, okay, so let's take a break until 9:30. At 9:30, you guys have your notes. So Valerie and Katie will go first. We're going to go in order of how I didn't pick any order. I just, whoever sent them to me, you were the next ones I added to my slides. So we'll go in order of what our notes are. Kind of keep track. Be ready after that group's done presenting to come up and do your presentation. I'm going to bring up that slideshow. Yeah. All right.
So we have rubella. It's also known as German measles. Just an interesting fact. If you want to get measles, this is the one you want to get, because it's not as contagious, doesn't last as long, it's not as bad. The reason that it's called German measles is because originally measles and rubella were thought to be the same because they have a lot of the same symptoms, but in the 1800s, German doctors figured out that this was a different virus, so they called it German measles.
Yep, that arrow. Oh, not going. Hold on. There we go.
Just don't take my blood pressure. All right, so the infectious agent responsible for rubella is just rubella. It's transmitted through droplet and person-to-person contact. Incubation period ranges from 12 to 23 days. The average incubation period is about 17 days. It is the most contagious 1 week before to 1 week after the rash appears, and about 25 to 50% of people with rubella have no symptoms, but they are still contagious.
The signs and symptoms are like red rashes. It looks exactly like the other one. It starts in the face and it moves like lower. You have swollen lymph nodes, and then women get arthritis. The diagnosis is they get like a virus culture or a blood test. It detects the antibodies of rubella, and then risks are pregnant women because it can transfer to the fetus and it can cause them to have a miscarriage. The kids can be born with hearing loss or learning disabilities. Infected during first trimester, congenital rubella syndrome, and it causes cataracts, low birth weight, and liver.
All right, so mild symptoms are managed with bed rest and antipyretics, but there's no cure for it. The measles, mumps, and rubella vaccine, the MMR vaccine, is 97% effective at preventing rubella. The CDC recommends the first dose of MMR at 12 to 15 months and the second dose at 4 to 6 years of age. The same vaccine as the last one. There's no significant evidence that the MMR vaccine causes autism. Fever is the most common side effect after receiving the MMR vaccine.
Avoid contact with those that have rubella, so quarantine if you have positive rubella. And then complementary therapies are like massages and acupuncture or like joint pain.
That's it.
So the MMR vaccine is measles, mumps, rubella. So it's all combined in one vaccine. Okay. So with your MMR, think about when you're thinking about why a pregnant woman cannot get it, is one, it can cause birth defects in babies, or it can cause miscarriage. It is a live vaccine, and so it could be transmitted as the actual virus to the baby versus the antibodies. Okay, so that is why a pregnant woman cannot get the vaccine in pregnancy. She needs to get it 3 months prior to pregnancy, because again, she could have that live virus in her system if she got pregnant prior to the 3 months. And then immediately after delivery. Okay, it does not cross the breast milk. Okay, so they can breastfeed and have the vaccine prior or after delivery. Okay.
Are you just definitely planning on getting sick then?
Well, what happens, like, say if your MMR, like say they do your rubella immunity and you're non-immune. So what we tell moms is that they're non-immune to definitely be careful to, if you have family members, friends that have kiddos that have rash, or they have a rash, or someone said that they've been recently sick with like an upper respiratory infection, just recommend them to stay away. So that's when education becomes important, because you want to educate that they are at greater risk if they get exposed in pregnancy, they don't have the vaccine, they need to just watch who they're around. So you don't want them to get sick, because if they get it while they're pregnant, then of course the same thing, just like if you got the vaccine, you're going to expose baby. Okay, go ahead.
Okay, so we had mom.
Okay, so it's an infectious agent that's called paramoxovirus, and it's from the family Rubuvirus. The mode of transmission is direct contact of the saliva and respiratory droplets. The incubation period is 16 to 18 days with a range of 12 to 25 days. So between that is when it grows and festers. The most contagious is 5 days after you get the swelling. The swelling will be shown in the other place.
Okay, so the signs and symptoms include a swollen salivary glands and pain with them, fever, and weakness and fatigue, headache. And so this is what it looks like. That parotid gland is just swollen on that.
So the diagnosis is mumps is usually diagnosed if you just ask the patient, so like the mom, if she's had the vaccine recently, or and then doing the blood tests to diagnose the patient with mumps. And then lastly, obviously you can see it if you have like eyes to look at mumps.
If you ever see a child with a swollen salivary gland, and they can have infections that cause it also, but that's going to be your initial thought, is have they been vaccinated, have they been exposed? Because has anybody watched The Stand? Okay, so if you watch The Stand, there's a virus that causes their neck to swell, and when the first time I saw it, I was like, oh my gosh, that's like the mumps. So they have like a swollen second jowl is what it looks like.
So it's more at the bottom.
Yeah, it's going to be like right here.
And risks for this patient with the disease. So children, poor hygiene, anti-vaxxer moms, newborns, immature immune system, immunocompromised, easier time getting infections in people without the MMR vaccine.
So,
Nursing intervention.
interventions, infection control, offer the vaccine if it's available, and then education will be the most important intervention, like hygiene, kind of stuff like that. And then in serious cases, isolation, just on the more serious spectrum of things, and then also education on nutrition. And if it's really bad, like she said, with like 101 and worse, maybe take like Tylenol or ibuprofen or something.
And then prevention is the vaccine, the MMR vaccine, and this vaccine is live. It's 2 doses at 1 year old and then 4 to 6 years old, and then staying away from sick people.
I always get these
The
complementary alternative therapies. So if you don't want to like use medicine, you can just do these things, just cold compress, salt water and gargle, and then heat compress.
some complications, if left untreated, swelling can occur in the testicles, brain, and the pancreas. And then
These are
Awesome. Thanks. Rotavirus. Arrow there to the right. There you go.
We're going to be presenting the rotavirus. The disease process, the rotavirus is the most common cause of dehydration in children and 1/3 of all hospitalizations for diarrhea in children under 5. In the US, its peak season is October through May. About 500 rotavirus associated deaths are reported annually. Mostly are children under 2. Mode of transmission is fecal-oral route and can be spread by a person that shows no signs of having the virus. Also, eating contaminated food and not doing good hand hygiene spreads easily among infants and young children. The incubation period is about 2 days according to the CDC, but according to Tabors, it has a short incubation period of 1 to 3 days. The person is most contagious when they have symptoms and after the first 3 days of recovery, because they'll be excreted. Clinical presentations, signs and symptoms. The symptoms start about 2 days after a person is exposed. Common symptoms are severe watery diarrhea, vomiting, loss of appetite, dehydration, fever, and or abdominal pain. Vomiting and watery diarrhea can last 3 to 8 days, causing dehydration. Signs of dehydration are decreased urination, dry mouth and throat, feeling dizzy when standing up, crying with few or no tears, and also causes unusual sleepiness or fussiness. Diagnosis, the rotavirus is diagnosed based on symptoms and a physical exam, and a stool sample is taken to confirm the diagnosis.
So some of the risks are children that are 3 to 35 months, especially if they go to daycare. It's most common in the winter, as you can see in the picture, and if you're unvaccinated. Some nursing interventions that we can do is check vital signs, check the pain level, give food and water, check the electrolytes, put them in contact precautions, and make them wash their hands all the time. So for prevention, we have 2 different vaccines. They are very similar. The only difference is that one is given in 3 doses and the other one's given in 2. It's the RotaTech and the RotaRix.
As you can see, the slide right here is just telling you a little illustration of what happens, of what my colleagues have said. Next, education. The biggest thing we need to worry about is vaccination. We don't want to really, it's just get vaccinated. The numbers are up there. As you can see, protection in the first year of life, 85 to 98%. That's pretty successful, I think. Then the second one is protection of any severity. So if you get it in, like I said, it's there. Next, complementary and alternative black magic voodoo here. I'm not a big fan. It's really for all the witches and wizards out there. You have the tea, the elderberry, peppermint herbs. Pedialyte makes sense to me. The common cause for death of the rotavirus is dehydration. So let's just keep you hydrated. The teas and the herbs, they're there.
They can help symptoms. They can help symptoms.
It's really, the research is wishy-washy. So, yeah. So there's really not, the only real thing on there is just the Pedialyte and the activated charcoal. So I believe in that. So, but if you want the herbal medicines and whatnot, continue on. And that's it for our slides.
Thank you. Okay.
Okay, we got erythema infectiosum, which is also called Fifth disease. It does cause a rash on the cheeks, arms, legs, and the back. The damages what it can cause fetal damage, or so someone can have an abortion from it, stillbirth, polyarthritis. The virus that causes this is the human parvovirus, B19. The mode of transmission is respiratory droplet. We also found that it can be transmitted through blood products and mother to fetus.
So there's stages. There's a fresh stage that's an incubation period. It's from 7 to 14 days. That's the period where the child is contagious. Rash has not appeared yet. And then the second stage is a rash has appeared, and it's 2 to 3 weeks after exposure. And that's the period where the child is no longer contagious. The third stage may last 1 to 3 weeks. And after several weeks, the rash can reappear. There's things that can trigger that are sunlight, exercise, and temperature, and stress.
The incubation period, which is the first stage, that's like she said, 7 to 14 days. Did we not delete that? Okay, well, we weren't supposed to read that. We put that together in here.
Okay.
So it's the 7 to 14 days. The period that's where it's most contagious, like Nellie said. The signs and symptoms of the first stage can be mild fever, mild headache, and cold-like symptoms. Signs and symptoms for stage 2, slapped cheek. It just looks like someone slapped a little kid in the cheek. It's just really red. And the third stage, you'll have a rash on the chest, arms, and thighs. And that's how it kind of looks for the first and second stage.
And it looks, how to diagnose it is just a slap cheek. If they see that, they're pretty much diagnosed. But there is blood work to determine if recently infected immune to disease. And some risk factors would be someone with leukemia, weakened immune system, HIV infection, and then complications would be chronic anemia.
For prevention, NSAIDs pretty much just kind of help it treat it a little bit. To prevent, you can make sure they wash your hands frequently, tell them to drink plenty of fluids, avoid contact with pregnant women for sure, and cover mouth when sneezing or coughing. We didn't find any vaccines for this. And intervention, just pretty much alleviate their symptoms, so NSAIDs can reduce the fever.
So, on education, we want to educate our parents, and for the kids to wash their hands, infection control techniques, wear masks, if somebody's sick, keep away from immune suppressed patients with contagious, and the child is not infectious with wash fevers. And some complications from high fever would be seizures. Try to control the fever if it's pretty high.
Alternate medications could be green tea, which can help protect against erythema caused by UV. Aloe vera, yarrow, lemon balm will help with the inflammation. Sage extract will reduce inflammation as well, and golden seal can also be used for vegetables. And we didn't do a works cited, but we used WebMD and CDC.
And this is one of those common childhood diseases or illnesses you're going to see with kiddos when they start school or like daycare. Very commonly spread. Chickenpox. Sorry, that's my Star Wars.
That's clap for us. That's
Rude.
all right. Players.
Okay, okay, so me and Rosanna had chickenpox. The disease process is highly contagious, caused by a herpes virus, or varicella zoster virus. Transmission can be direct, airborne, droplet, or indirect by touching objects that are contaminated. Disease process, incubation 14 to 16 days, range of 10 to 21 days after exposure to someone with chickenpox or herpes zoster shingles. Most contagious 1 to 2 days before the rash appears until all the blisters are dry and clustered. A weak immune system may be contagious for a longer period of time. Okay, clinical presentation, initial symptoms, slight fever, fatigue, and weakness, which is the same. Then followed by itchy, blister-like rash on the chest, back, and face. And then from there, it'll spread all over the body. And that's how it is. And my baby got that when he was 6 months. And it was really hard to not grab it because they would pop everywhere. It was really bad. Diagnosis, rash, blood test, culture of lesion samples. Risk factors, bacterial infections of the skin and soft tissues in children, including group A, streptococcal infections, pneumonia, infection or inflammation of the brain, hemorrhage, sepsis, or dehydration. Nursing interventions, educate importance and safety of the varicella vaccine, manage pruritus, which is like itching, cold compresses, regular warm baths, oatmeal or cornstarch baths, reduces itching, provide comfort, prevent dehydration, maintain their fingernails short to prevent scratching, administer medications such as antihistamine to relieve itching, and antiviral drug for high-risk people to prevent complications. The calamine lotion to treat itching and skin irritation, and Tylenol for mild fevers. Prevention, vaccination, which is a live vaccine. There's like a picture one. So keep away from infected people, hand hygiene, and just be aware that it can be contact, it can be anywhere. And the CDC recommends 2 doses of varicella vaccine for children, adolescents, and adults to protect against. Children are routinely recommended to receive the first dose age 12 to 15 months and the second dose 4 to 6 years. Education, do not use aspirin for fever control. The development of the Rett syndrome is associated with dilatic administration in children with chickenpox. Infected person needs to stay home until blisters are dry up. Trim nails to avoid further irritation with scratching. Management of symptoms, signs and symptoms for further complications. And CAMs, alternative medications, herbs, can use cayenne, German, chamomile, licorice, acupuncture, and homeopathy. They had a lot of different I can't pronounce them, but there's more. Oh, I only put a little bit, but there was a lot more.
Diphtheria. Okay, so we got diphtheria. The infectious agent responsible is Corynebacterium diphtheriae. The mode of transmission is through contact with respiratory droplets in the nose or eye discharge, or by the skin lesion itself. The incubation period is between 2 to 7 days, but it could be longer. And it's most infectious around 2 to 4 weeks or until 4 days after the antibiotics have started. The signs and symptoms is a sticky, sometimes grayish lesion on the pharyngeal membrane, and it does have potential for airway obstruction. Some other signs and symptoms are sore throat, enlarged tender cervical lymph nodes, and they may also have a swollen neck. I just put some pictures, like the first one is kind of what it would look like if it was gray. The second one is more realistic. It's kind of like white and yellowish, but you guys can see how it could have the potential for airway obstruction there. And then the third one is just a child with a swollen. To diagnose this, they would do a culture from any mucous membrane or from the skin lesion itself, and some complications that can arise from this disease process. So the organism produces an endotoxin, which is a toxin inside the bacterial cell that's released when the cell disintegrates. And so that'll cause myocarditis and peripheral neuropathy. And from that arises slurred speech, double vision, difficulty swallowing, paralysis of the palate, or ascending paralysis.
Okay, so some nursing interventions are monitored closely for signs and symptoms of respiratory distress, cardiac and central nervous system complications. Monitor the ABCs and have emergency airway equipment nearby. Encourage liquids if they're tolerating it. If oral suction is necessary, be very gentle with it. Administer antitoxin and antibiotics as prescribed. Do not give any medications containing caffeine or stimulants. Preventative control, use transmission-based precautions along with droplet and contact, and isolate the child. The vaccines is the Tdap, which is like the original dose given, and then the DTaP is the like booster part. It's considered inactive. Education for the patient and the family. If they do have diphtheria, they should be treated immediately because it can, if not treated, it can be deadly. Diphtheria can be prevented with that's supposed to say DTaP. But be on the lookout for a swollen neck due to enlarged lymph nodes, as this can be a big sign of diphtheria. Some alternative therapies that I found were pineapple juice, because they have beta, I don't know, which can effectively cure it. Basil leaves have antibacterial properties that can help cure respiratory infections, and passion flower can aid in reducing the symptoms of diphtheria.
Yola. That arrow right there. Okay.
We had roseola, and roseola is a contagious illness that is formed from herpes. It can enter the body through the nose and the mouth. The incubation time is first when you are first exposed until the fever starts, which is usually 5 to 15 days after the exposure. Some of the symptoms are a high fever, which can cause seizures, and a runny nose and a sore throat. As the fever goes away, that's kind of when the rash will kind of start to develop, and it can either be raised or flat. It starts with the trunk of the body and then spreads to the arms, legs, and face. It can also have swelling in the eyelids, swollen glands, ear pain, a poor appetite, and irritability. There's no specific test that gets done for roseola. The provider will get a health history and a physical exam. Usually a high fever and a rash are enough to diagnose the patient. Since this is a viral infection, there's no need for antibiotics. Educate them to drink plenty of fluids, and you can have Tylenol or ibuprofen for the fever and discomfort. And it is a contagious disease and can be passed to others.
So some of the risk factors, it's most common in children from 6 months to 15 months, and older infants are at like greater risk of contracting this disease and dying from it, because they haven't really developed their own antibodies yet to fight this virus. And with like the main thing with this is like the rising in temperatures that can be really detrimental to their little bodies not being able to fight it off. Some complications, like she said, you can have seizures because of the high rise in body temperature. They can also lose consciousness. They can have the little jerks in their arms, legs, or heads like a seizure would. They could lose bladder and bowel control just like a normal seizure would. Also, people with like weakened immune systems, so if they recently had like a bone marrow or like a organ transplant, they're more susceptible to this disease just because it's they're immunocompromised. And so you always want to educate about good hand washing. That's with any communicable disease. While the fever is present, you want to keep them away from others. But once the fever is gone, like the children are no longer contagious, but they'll still have that rash. So you want to monitor the fever just to make sure it doesn't get really high, because they could cause febrile seizures. That's one of the big things with roseola, because like most of these diseases have that like rash on the body, but this one presents more with that high fever. So just assess for like that seizures, put them on precautions if need be. Visit the provider before you use any like alternative therapies, just to make sure it's not going to interact with anything. Okay. There is no vaccine for this, since it's kind of, I don't know, like not like the other ones. So the best thing to prevent it is if your child does have like a high fever and the rash, just keep them away from other children so it doesn't prevent like an outbreak of it. Teach frequent hand washing, even in infants, like getting the bubbles and all that. By the time most children hit like preschool and stuff, they have the antibodies to fight against it. So when they get like a second infection that's more mild, that they can fight it off. Adults who didn't get this as a child can get it in adulthood, but they have like the mild symptoms. But if they were around an infant, they can still pass it on to them and get them really sick.
Some education is to make sure you use good hand hygiene. If the child is sick, keep them home if they have a fever and away from others. Monitor for the high fevers, and you can use lukewarm baths to help bring the fever down. Don't put them in anything cold. Clean and disinfect commonly used areas. And children who can get roseola from talking, sneezing, coughing, or touching the same surface as somebody else. Some CAM alternatives. Of course, get plenty of rest and drink fluids. The baths. You can ask the provider about over-the-counter medications. Some herbal teas can help bring the fever down, but make sure you discuss those with your provider. Peppermint, lemon, and elder are some ones that are known to help with fevers. Some people do use acupuncture, and sometimes the parents will massage the child's feet in the back to help with the pain. And they have some homeopathy, but I didn't put it on there because they said it mainly depended on the child and what that provider liked.
push that arrow right there. Okay, we have hand, foot, and mouth disease. It is caused by Coxsackie virus, A16. We can find this one in United States, and this one is more in Asia.
The mode of transmission is mostly like person to person or respiratory droplets. It's most common in little kids, so like contamination of like their toys and sharing utensils and stuff. The incubation period is 3 to 6 days.
Okay, signs and symptoms: fever, mouth sores, skin rash, hand, mouth, and feet, sore throat, feeling, and drooling. We have some pictures.
The diagnosis is there's really no like test that like really diagnoses it. They just look at the history and the physical assessment, like their rashes or like telltales. They look for the hallmark signs of the disease, like drooling, sore throat, the fever. They assess the rash and like blisters, and sometimes they'll swab the sputum and stools so it can be confirmed.
How we can see, that's how it looks like. For patient risk is viral meningitis, dehydration, fingernail and toenail loss. How it looks like. Encephalitis or paralysis, malaise, and loss of appetite.
Interventions and infection control are relieve pain, antipyretics, antihistamines, improve the integrity of the skin, improve the nutritional intake, and just to prevent infection.
Infection control. We have to use gloves, gown, N95 respirators, and we have to use droplet precaution. We have a picture there.
For patient teaching is just keeping the blisters and the scabs clean to like prevent the infection, and also pain and people. Oh wait, I'm on the wrong one. Sorry. Prevention is good hygiene, the use of the droplet precautions, and there is a vaccine that just came out like a couple years ago, but it's only used in Asia. It's not something that has come here yet. Well, also because it's to the virus that's like localized in Asia. That's not a virus that's really common here. And then not sharing cups or utensils.
And patient teaching. They have to keep the blisters and scabs clean and avoid touching, and pain and fever management. So we got pertussis. So some quick facts about it. It's known as whooping cough, and it's when like the patient has a very severe cough. There's 2 vaccines available, and it's very rare. It's less than 200,000 cases a year.
Yeah, so pertussis is really dangerous for children. It is really airborne, so you gotta be careful with it. It is highly contagious through droplets as well.
Okay, so the pathophysiologist, it's highly contagious infection found in the respiratory tract, transmitted through droplet. It is caused by a gram-negative bacillus called Bordella pertussis. It is and it releases toxins in the tract or in the throat and damage the cilia, causing inflammation and swelling. Symptoms vary through stages, and it's a 7 to 10 day incubation.
So some signs and symptoms for pertussis is has some cold-like symptoms, some sneezing, running nose, mild cough, watery eyes, and sometimes even mild fever. So children during this stage, they may be highly contagious, so just gotta watch out for that. So stage 2, you still have the cold symptoms. They get better, but the cough gets really worse. So you probably hear those nasty coughs. It goes from mild to dry to a severe cough that the child can't really control.
So you may want to watch out for the respiratory distress or them not having good oxygen perfusion because they're coughing so much. Stage 3, the patient may still have symptoms and feel better, but the coughing may get louder. So the coughing may flare up if they develop a cold, or the cough may come and go. So we go back to that recurrent virus or that recurrent disease.
Okay, so diagnostic test. Culture test or throat swabs, chest x-ray determines fluid or inflammation in the lungs, and then some elevated white blood cells or get a blood or what is that? A CBC.
So some risk factors. Of course, you have younger children than 10, 12 months, having a severe illness or a weak immune system. So like children with like leukemia or something. Patients with asthma. Kids who lives with someone that has a whooping cough. So other children, brothers and sisters.
Some nursing interventions encourage patients to drink lots of fluid because dehydration is a big effect. Inform patients to eat smaller meals to avoid vomiting after coughing. Provide a humidifier or clean air to reduce irritants that can trigger patients to cough. Provide a dark room, and prevent transmission by simply washing hands after coughing. Some treatment, it's treated with erythromycin for 2 weeks or antibiotics like betamethasone. Cough suppressants will not work on this, so like your NyQuil or anything. Humidifier or cool clean air will work. And the vaccines are the Tdap, and this one's given after 11 years and every 11 years after that. And then the DTaP is given to children under 7.
So some patient education for parents. Children with whooping cough need to take antibiotics for at least 5 days before and after going back to before going back to school. So children with whooping cough can't give them like over-the-counter medicines because it just won't work. Adults or teens with whooping cough need to take antibiotics for at least 5 days before being younger children are going to work. If a child has whooping cough, create a quiet, calm, and restful environment. That way you won't flare up the cough. Controlling possible triggers of coughing, such as smoke, dust, lights, and changes in temperature. The child should have small sips of fluid and nutritious foods. A humidifier in the child's room may also help, but it may also make it worse. A child who is 1 year or older should lie on their side or on stomach rather than on their back. Over-the-counter medicines typically don't help with whooping cough. Some complementary and alternative therapy for pertussis is the use of Bactrim, and patients 2 months or older who have a contradiction that can't tolerate heavy antibiotic agents. So that would be like penicillin or something. Whooping cough needs antibiotics, herbs, and supplements alone, especially for children, will not work. Will not work. You'd have to talk to your doctor about that. Complementary drug therapy reduces the chance of giving whooping cough to someone else and helps the host heal faster.
Okay, so we're gonna now go over some NCLEX style questions. Okay. Okay. So our first question. A nurse assesses a 4-year-old who was adopted from Russia and has had no immunizations. The child does not appear ill, but has a fine pink maculopapular rash that progressed from the face to the neck, chest, and back, then to the extremities within 3 days. Cervical and occipital lymph nodes are tender and enlarged. Which communicable disease would the nurse suspect? Okay, now this is just kind of based on some of the information we were given today. Okay, so think about some of those things your classmates talked about that has rashes, okay, has lymph nodes that are enlarged in this, what's cervical? Neck, right? Occipital, back here, okay, so enlarged lymph nodes, neck, they got a rash, okay. So think about each one. So scarlet fever, usually have a rash, right? We usually don't have swollen glands, okay? Hand, foot, and mouth disease, where does that usually affect? Hand, foot, and mouth. Okay, that's a good one, easy one to figure out, okay? Okay, a meningococcal infection, where does that infect? The meninges, right? Where are your meninges? Your brain and spinal cord. So, by deduction of what we know of each virus, probably rubella, right? Okay, correct, rubella. So let's look at the reason why. So the child's pattern of rash, eruption, lymphadenopathy is characteristic of rubella. The child with scarlet fever has a fine red sandpaper rash that spares the face and appears on the neck and trunk, and they usually don't have the swollen glands. The toes and fingers can peel, and a strawberry tongue is seen at 4 to 5 days. Hand, foot, and mouth lesions are papulovesicular, so they have those raised fluid-filled bumps, okay? I'm going to encourage you guys for your NCLEX, because I had, if I can remember, I had probably 2 or 3 questions regarding immunizations and vaccine-related illnesses, okay? That used words like papulovesicular, okay? So those are important things of when you know you need to learn how to break the word down, okay? So you need to learn what papule means, what vesicular means, okay? Yeah, so it's like a raised bump, fluid-filled sac, okay?
Is it like a polyp?
No, it's going to be more like what you see with chicken pox,
Like
kind
a
of.
pimple, right?
Kind of like a pimple, yeah. Okay,
Like a blister?
like a blister. So I encourage you guys to look at these types of words, okay? Break them down, figure it out, okay? In last 7 to 10 days, the child with meningococcal infection is very ill and has a red to purple urticarial, okay? Another word. Maculopapular or petechial rash that can progress to purpura. Okay, so lots of big words, right? Yep. But guess what? Your NCLEX, they're not going to use the nice, easy, fun words. They're going to use the big words. Okay? So, next. A father refuses the measles, mumps, and rubella, your MMR, immunization for his child because he does not want the child to suffer pain or injury, and he believes the MMR vaccine injection might cause autism. The priority nursing diagnosis for this father is which of the following? Okay, so what are our key words? Priority. Okay, priority. What did you say, Minnie?
Knowledge.
Okay, his knowledge, right? So we're not talking about the child, right? We're talking about the parent, okay? So risk for infection related to incomplete immunization series, risk for injury related to vaccine reaction, knowledge deficit parent, potential side effects of vaccines related to lack of correct information, acute pain related to injection, and associated anxiety. Right. That was one you could easily deduct, right? Because 1, 2, and 4 is talking about who? The child. 3 is talking about dad. Okay? So this one was not as hard. Okay, so 3. The father has incorrect information on immunization, so knowledge deficit is the appropriate diagnosis. The remaining options are appropriate for the child, not the father. Okay. The nurse teaches parents that absolute contraindications for pediatric immunizations include which of the following? Okay, so think back to what, in my little lecture, I kind of gave you some things that we probably shouldn't vaccinate when they have these symptoms. So respiratory illness with a low-grade fever, soreness, redness, and swelling at the previous injection sites, febrile seizure 1 month after the previous injection of vaccine, or anaphylactic reaction to the previous immunization. Okay, so let's break it down. So contraindication means you should not give it. Okay? Contraindicated. So indicated means you give it. Contra is opposing, so you should not. Okay? So contraindicated means you should not give it. So we're going to think, we don't have the word priority or important here, but still when we look at our answers, we want to go with the best answer, correct? So deduction, so respiratory illness with low-grade fever, he could potentially still get it, right? He doesn't have a high fever. He probably has a cold, potentially. It kind of would be up to the practitioner. Soreness, redness, and swelling at the previous injection site. Is that a contraindication? No, because that is just site irritation. That's normal. We kind of expect that with some immunizations. Febrile seizure 1 month after the previous injection of the vaccine. Do you think that's a contraindication? Maybe, but do we know it's specifically related to the vaccine? It's 1 month after. Okay. Now, if it had happened the day of, 48 hours after, possible contraindication. But 1 month, it could have been something totally different, correct? Do you agree? Okay, number 4, what's the big word there that tells us, no, we don't give that medicine? Anaphylactic. Okay? Anaphylactic. So this child had had a previous anaphylactic reaction, so immediately our brain should pop to number 4 and go, oh yeah, we're not giving that, okay? Because we don't know for sure what the previous immunization was. We don't know if it could be an allergy to egg or whatever, and we don't know if that child has an allergy. We just know that he had a prior anaphylactic reaction. We probably need to wait, okay? So again, anaphylactic. So immunizations may be given if the child has a mild illness with or without a fever. So even a low-grade fever, sometimes they'll go ahead and immunize because they're looking at the risk to benefit, okay? Is our risks or our benefits greater than our risks, okay? Anaphylaxis is a life-threatening reaction to an allergen or antigen and can occur again if the client is exposed to the offending allergen or antigen. Redness and soreness are common reactions, not contraindications to immunizations. Okay. The nurse knows that an immunization is an example of what type of immunity. Okay, so we talked about these at the beginning. So we know, tell me one we can immediately eliminate. I'm thinking vaccination. Because what's vaccination and immunization? Okay, so that's one I'm automatically going to, it's the same word as immunization. That's not something I know that's not a way it's, okay. Conjugated, I heard someone say conjugated. What's conjugated? Type of vaccine. Okay, it is a type of vaccine. Okay.
Type what?
Type of vaccine. Because remember we talked about conjugated vaccines, how they have they use, right, the combination, they use maybe a protein from a different virus to carry that antigen in. Okay, conjugated. It works together with something different than itself. Okay, so what's passive? Mom to fetus, breast milk, passive. So this is active because our body is actively working to build antibodies. I'm a word association person, so it helps me. So you have to find ways that helps you to study, okay? Like if I was looking up childhood immunizations. So I would tell you on my NCLEX. I had a question about what appropriate age to give this immunization to this child. I can tell you now, I'm not really good. I don't have it memorized. I don't have the schedule. I kind of have an idea when kids get their vaccine, but I don't have it memorized because I don't work with pediatrics except newborns. I just know they get their Hep B whenever they're born, and then I write 1 to 2 months on their little card when I fill out that they had it. That's what I know. So, along with you guys, I think it would be good for us to try to memorize some of those vaccines because you could get an NCLEX style question on NCLEX that asks you what's the appropriate age, or if you have a child this age, what vaccinations are they going to get? Okay. Yes, it's going to correlate exactly with what's on your CDC
When we do that in class, will they let us write on a paper?
When you go in for NCLEX, you get a whiteboard. Okay, that's erasable whiteboard. But you are not allowed to erase. So anything you write on that board has to stay on that board, and you give that board to them when you walk out. Nope. It's 1 8 by 11 square.
What if you mess up? Like you're doing like math.
Can't write, can't erase it.
You gotta mark it out.
Yep.
So why won't they let you?
Why are they so strict?
Why won't they what?
Why won't they let you erase?
Because they want to see what you wrote down. If you wear glasses, they're going to scan your glasses. They have a machine that scans your glasses. Seriously.
There's special glasses that you put in special contacts. You can see, like,
Yeah,
what-
you can see the writing on the lenses. Yeah.
They do that at Garden City too. When I went to go take my home health,
Yeah.
they checked my glasses.
Yeah.
I had to like literally strip.
Yeah,
like,
they,
everything.
yeah, you will leave everything. They'll have even like your phone, it goes into a special RDIF little envelope. So that way, like if you have some little something in your pocket that, I don't know, taps you every time you gotta cut it. What all things they think of these days, but you know, you have to put your phone, you can't wear your smartwatch in. Anything electronic has to go in the RDIF package. It goes in a locker. You can't take your purse in. You have to empty your pockets in front of the person. So very strict. They scan your hands.
Invisible.
Yep.
Welcome to the airport.
Yep. They scan your hands. They scan your glasses.
So
Yep.
somebody's like just watching you take your test.
Yep. And you have someone that, and so most places, like the place I took mine, the lady was behind a glass. So she was kind of like in a little enclosed office so she could work, but all the desks faced her so she could see our computer screens. You can't take your own, like if you want to wear covers in your ears, little plugs, you can't take your own, but they offer them there. They also have headphones you can wear. So, no, it's free. They don't charge you. That's part of your fee when you paid it.
Wait, but why can't you bring your own earplugs? Can't they just be like, oh yeah,
Nope.
this is thing?
You cannot take anything in with you, because it could have a speaker.
Earbuds are specific.
What about a piece of gum?
Like,
Nope. No food, no drink, no gum.
What if they catch you with like some spy glasses or whatever? Do they like not let you take it, or do they
You can't
just
take-
take your glasses and let you go in?
They probably wouldn't let you take it that day, and then you would have to pay the whole process over again. So,
You have to study.
yeah, yes, ma'am.
Where is this test taken?
You will take, it's up to you. You can actually test, pretty much anywhere in the United States. There's testing centers. It's Pearson who does the test. You sign up for a testing center. So when I did my LPN, I lived in Durant, Oklahoma, and I took my test in Dallas, Texas, because my family lives in Dallas. We wouldn't stay the night. I went the next day and took my test. When I took my RN, I took it in Amarillo. Usually when you get your cleared to test, okay, you want to look up where the closest place is. So, because a lot of times, I mean, think about it, everybody's graduating about the same time of year. So those test dates, as soon as people get their authorization to test, then they fill up fast. So when I looked at Amarillo, Colorado Springs, Oklahoma City, anywhere within a good driving distance that I could go just stay the night before, get up and go test the next day. So, yeah.
How long do you know your results?
Usually it depends. Like I tested when I did my LPN, I tested for Oklahoma. And so Oklahoma, within 24 hours, it will upload your license number. And so like the next day I was able to go online and type in my name on the Board of Nursing website and it popped up my license. And so I knew within a little over 24 hours. When I tested for my Kansas, for my RN, it took about 36, 48 hours. You can pay Pearson like $50 extra, and they give you a pass or fail. And they don't, but they say it's not, accurate, but it is. They're not going to tell you you pass when you really fail. Right, because you're paying for it.
It failed, but I passed.
Right. And so, you know, it's, you know, I always tell people when you go to take it, there's so many people, everybody has different strategies on studying. My sister's finishing her RN right now. She actually applied for, she lives in Jacksonville, North Carolina. She applied for a nurse residency program through the hospital there in Jacksonville. It's a pretty big town. And she got the job, and she said that the nurse recruiter told her, you know, you can start when you want. So if you want to start as soon as you graduate and work as a graduate nurse until you take your NCLEX, or if you want to wait and take your NCLEX and then work. So she asked me, what would you do? And I said, well, if I had the option to not work so I could study more, I would not work and study and then start. Because, you know, you've got to look at it this way. I've known people who just say, oh, I'm just gonna study, I'm gonna go take the test and see how it goes. And they fail. Okay? What you guys don't understand, a lot of people don't understand, is that if you do that, that it reflects on our program. So then if our pass rates go down, because they don't look at the second and third tiny test, they look at that first tiny test. In each class, if that pass rate goes down, we could lose our program. So that's how important it is. It's not just important for you guys. We want you guys to be licensed. I mean, that's what we're here for. But it's also important for our program when you go that you're well prepared. I don't know what, we don't know this last year. The year before was 80-something%.
Yeah.
PN's almost 100, but RN's like 80. So.
OPNs are 100?
Almost 100. It's, yeah. The LPNs, y'all, a lot of them tend to pass the LPN really easily. So, because there is a difference in the test. Because you're still thinking like a nurse, but there's different content. You're not having to think of being in charge, basically. You know, you're not having to think about, you know, okay, I'm the person in charge. What do I do? You know. So that's why, you know, we really want you guys to be successful. And when Janessa was in here yesterday, we really do. So whatever you guys need, I mean, that's what we're here for. So when we're back in our offices, we are working, but, you know, text me, call me, can I come in and talk to you? If you're here, come check and see if I'm not busy. You know, I will post as much information as I can. Helps for you guys. And like I said, I'm creating a Word doc right now that has several different apps and websites on it. So you guys can use those to practice modalities first.
In the summertime, what exactly, is it a class that we just take tests or is it just clinicals?
So the class you guys will do will start the week after. It'll start our last day here is the 14th. It'll probably open up that week so you guys can actually get on and look at the content. Most of the classwork will be online. You will come in one day a week. We haven't decided if it's going to be a 4 or 5 week class yet. We're still working on it. The first 2 weeks will be clinicals. So it'll be pretty heavy clinical. I'm going to do the clinicals at the hospital. So we'll do 4 10-hour clinicals the first week. You're going to be split probably in 2 groups. And then the next week, the other group will do 4 10-hour clinicals at the hospital. And if you're not at the hospital, you'll be in a clinical setting like we're looking at doing wound care again, Dr. K, Dr. Flores, family practice, kind of having you guys in there because you have to have 90 hours of clinical time through the summer program, summer class.
Is that how it is for like every program? Every program has to have that extra class?
Some people have it incorporated into their program through the semester, and that's what the new curriculum will have done. And then some don't. Like some programs, like my sister, she was an LPN and did her LPN to RN. So she actually did her LPN to RN in North Carolina, and they had a summer class. So. Okay, so we still have an hour. Too early if I let you go now. Dr. Campbell's gonna be like, what?
Well, like, one at a time.
Yeah. Can't do that. So I'm gonna give y'all till we'll do 10:45. I printed off a case study regarding vaccinations. You can use your devices if you have your book. That's fine. There's a couple books back there. I'll bring my book in. But utilize it's just the front and back page. There's like 5 questions on one, 4 questions on the other. Okay. When it gets about 11:20-ish, if anybody needs to take a long 10-minute bathroom break.
What about now? We need to take one now.
Well, you can't till 10:45, and then you gotta come back.
Are we doing the case study as groups or alone?
Yes, you can do them as groups. Just go ahead and turn in individual papers for me. You can either turn it in on paper, because I'm gonna give you a paper, or you can upload it either way. Okay, so let me go grab those. I'll be back here at 10:45. I'm gonna grab my book too. There's a couple maternal health books back here that are specific, the ones we have, and then some others, but you can use even the other ones. Yes. Yes.
Dialing.
Okay.
Breathe.
Candy got you?
It's okay, ma'am. I know high school pharmacy.
Grab my book. There's a book if anybody needs that.
I didn't know that either until I saw that. I was like, oh my god. Like, yeah, put antibiotics on it. Like, it's some good pancake, but not if it costs that much.
You don't feel anything at all.
Have you ever tried paper? I pause. So,
My sister called me the other night telling me that she doesn't know if she should vaccinate my nephew. And I was like dead asleep, and I don't know why I picked up the phone. And this goes with that.
So, like, how old
And
are
that she was watching a video, and the lady said that vaccine has so bad for kids, and that if you feel bad for getting a vaccination, how do you think a kid getting 5 of them at the same time feels?
Little Fetus got 7 the other day all at once.
And she's like, I don't know about something like this and that. And she said that she doesn't vaccinate. She vaccinated her son, and then she didn't vaccinate her daughter, and her daughter's much better than her son.
Oh, well, that's always good.
Yeah. So my sister's like all panicking.
How old is your nephew?
He's 9.
Tell her that if he doesn't go to daycare, if she feels more comfortable spacing them, that is appropriate and that's her choice, you know. But it's still important to vaccinate. Because what I would tell her is, why don't you look up videos of children that have whooping cough, measles, mumps, polio, rubella, polio, and see how their life is, you know, especially polio. Like my daughter the other day, she was like, oh my gosh, we watched this video about this guy that draws it, but he like lives in this tube. And I was like, then he probably had polio as well because it affects your nerves. And I said, so he can't breathe, so he's in an iron lung who helps compress his lungs so he can breathe. And I said, there's very few people these days that are in them anymore because we've eradicated it. It's not a common thing to see. So that's what I would tell her. Why don't you look up the videos of the kids who get these diseases and then decide.
How many vaccines does Timothy at one time?
I mean, the schedule they have isn't tested and it's appropriate, you know. But what I tell people is they're concerned about the number they get at once.
Yeah.
If they're able to space them out, that's their choice. That can happen. You know, they don't have to get them all at one time. If they want to get one set 1 month and go back in another month, you know, another.
I thought 7 was kind of expensive.
It is, but usually that's what, 6 months? Year.
Yeah, she's like 13 months.
Yeah. Usually there's like 2 times that they get twatted at one time. You know. And they're gonna, I mean, the way I look at it is they're gonna be sore for a couple of days and they're gonna be cranky for a couple of days, but then they're gonna be better and they're fine. You know. So, yeah, I don't think, I mean, because the way they stretch them out is, you know, it's been studied. So. I have an extra book here, and I also have the book on my iPad, so I'm changing my settings.
How did you put your book on the?
I just bought the ebook.
Oh, okay.
On the paper.
Yeah.
I will.
I have my book.
I'll start on the front, I'll start on the back.
You have the book. You can take pictures.
Just kidding.
Has like. To the front or onto
And they have a lot of
I
recommendations.
have in the front.
I'm trying to reset my
I don't mind doing the back.
screen.
Hey, Amanda, I didn't go that one day to your office to see about my test that I wasn't able to review.
After we're done here, I don't have anything till 1. So.
I can do it today.
Good. This was traumatized and you're all like, your parents put in my school. I don't know.
Is that for your Janessa?
I did too, but I got shingles. I had like shingles, like.
Have you
like,
seen it
if you
already?
get shingles, like, you develop shingles like when you're older. And like I had it around the eye, and it was so close to getting in my eye, like we had to have a ophthalmologist surgeon call just to put into my eye to get surgery. Yeah.
Does anybody else need a book? I mean, it's gonna help you answer your questions a little more correctly.
We're going